Dr. Femi. So, any questions conti our questions contact very low and I'm very sure you are ready to answer the question. Am I worried? Just normal question concerning your medical line and all. So that as if you enlighten
Listeners,
our
viewer.
audience, so they will know more about anything medical and how to take care of it. So first of all, my question is, kini o man generate, or let me say, kini o man leads to hypertension?
Hypertension èyí tí àwọn Yorùbá máa ń pè ní ẹ̀jẹ̀ ríru àbí ìfúnpá gíga. Well, generally, there is no specific thing that we can say is responsible for hypertension. Okay? But there are things that can lead to development of hypertension. Okay, now I'll give you an example. When they ask, kí ló ń fa malaria? We know that it is caused by a parasite known as Plasmodium falciparum. Okay? But hypertension, on the other hand, we cannot say this is the particular thing that causes hypertension. But I will go ahead and tell you things that can increase the risk of an individual having hypertension.
Okay.
One is, as we increase in age, the risk of developing hypertension increases. Okay? So, and that is why most people that have hypertension around us are people above the age of 60 or above the age of 50. But of course, in the recent time, we are now having young people coming down with hypertension, and this is not far from the kind of habits that people engage in. For instance, smoking increases the risk of having hypertension.
Smoking.
Yes. Okay. Smoking, because when you smoke, it affects your blood pipes. Okay. And what is hypertension generally? Hypertension is when your heart is pumping blood at the rate that is more than the normal rate. If a generator is about to die, you will hear the generator boom. So the heart is pumping blood above the pressure that is supposed to pump blood. And then when you smoke, the smoking destroy the wall of your blood pipe. So when it destroys the wall of your blood pipe, it narrows the blood pipes, and as such, blood is not flowing easily in the blood pipe, and that can lead to hypertension. Too much of salt, when you take excess of salt, it can increase the risk of hypertension. People that have family history, a parent has hypertension, your mom, your dad, your uncle, your aunties, they have hypertension. You need to keep watch, of your blood pressure regularly, because you have the risk of coming down with hypertension. Sedentary lifestyle. What do I mean by sedentary lifestyle? People that doesn't exercise regularly. People that work in bank, for example, they go to work maybe by 7 a.m. or even earlier, and then they leave work late at night. And if you notice, they are always on their seats. Attending their customers, so they don't move around. So when something is on the spot, there is a tendency for it to clutch together, and so that's another risk for an individual coming down with hypertension. We have also talked about obesity. People that are obese, they also have risk of developing hypertension. Like I said, there is no specific cause of hypertension. There are things that can cause that can contribute to developing hypertension in the society.
Okay.
Sorry, I want to say, I want him to put more elaborate on that hypertension. Is it hereditary? Show hereditary.
Because he was saying something from family.
Okay. Hypertension is not hereditary. I would say it is not hereditary because there is no particular genetic disorder. Because when you say something is hereditary, there must be a genetic relationship between it appearing in an individual and it reoccurring in the children. You understand? There must be a genetic predisposition. For instance, now if you talk about sickle cell disease, which is SS. Okay, so it's a gene that is located on the red blood cells. So if the mother is AS, the father is AS. The X from the father and the X from the mother can come together to form SS. But on the contrary, for hypertension, there is no particular gene in the parent, understand what I'm saying, that we say that if you pass that gene into your child, you are going to develop hypertension. However, like I said earlier, if your parent has it, you have the risk of also having it. That doesn't mean it is genetic. It is because, okay, now for instance, my parent is obese. I have the tendency to be obese too. And if I'm obese, and the risk factor in my mother that makes her come down with hypertension is obesity, and I'm also obese. I've also acquired the risk factor through that.
So there's
you understand? So it is not genetic, But when the parent has it, there is risk of the child or the children also coming down with
So
it. But
that's
it's
like
not
50-50, right?
I wouldn't say 50-50. And that is why if you know your parent has it, there are things you can do to help prevent it yourself. You exercise regularly, you stay away from excess of salt, you eat fruit and vegetables, you ensure that you check your blood pressure regularly. You understand? So, but it is not genetic, but there is higher risk in people whose parent has it.
Okay.
Those that work in the sports facilities, those that work as an example, a footballer, because I have once had a story about a footballer that went off, and can it lead to that too, because of too much of exercise or too much of because when you're talking about stressing the heart, can it also, so being an athletics, being a football or footballer and every other thing, does you have chances of that as well?
Oh, okay. On the contrary, being a sport person is rather helps you to reduce the risk of you having hypertension. Okay, because when you exercise, you lose some fat. Okay. When you exercise, you help to keep your body fit. You understand? So it actually, on the contrary, helps to reduce the risk of coming down with hypertension rather than increasing the risk of hypertension. However, people that exercise, people that do sports, they need to pay attention to their heart. It is not only hypertension that is disease of the heart. There are other diseases of the heart.
Of course.
People that have congenital heart disease. People that has what we call cardiomyopathy.
That's a cardiac arrest, right?
No. Cardiac arrest is different from cardiomyopathy. Cardiomyopathy is a disease of the heart itself. So you need to know the state of your heart when you are going for sports activity, especially if you are going to be a career sport worker. And that is why you see when they want to sign a player, they say they want to do medical
checkup.
Part of the thing they do is to do ECG, which is electrocardiography, checking the electrical activities of the heart, how the heart is functioning. If you have a defect in your heart, they might need to advise you maybe to stop doing sport activities or to give you some medications or do some intervention for you to help put your heart in the right condition, or possibly give you some warnings that okay, if you feel this, please, you have to rest. You understand? So it is not only hypertension that is a documented disease of. There are so many diseases of the heart which can have effects when you are doing sports.
So like sometimes people say like when you think too much, I can't fry hypertension. You hear it. What's about Ronuju? Over fry hypertension and that kind of thing. She thinking about far. I think she anxiety as hypertension. She link one like.
Okay. Thank you for that question. So there is a particular hormone we call cortisol. It is stress hormone. Stress hormone. We call it cortisol. So when you engage in thinking, being bothered about things, when you are stressed, this hormone tends to increase in our body, and it has a little effect on your blood pressure, but it is not enough to cause hypertension. I don't know if you get my point.
Of course.
If you run from here to the nearest bus stop, you see the way your heart is pumping. It is because your heart needs to pump blood at a very faster rate to different organs for you to have energy so that you'll be able to run. Okay, so at that point, if you check your blood pressure is going to be a little bit high, above the normal. It is because you just engaged in an activities. So thinking, being disturbed with issues of life, which we cannot take away from our day-to-day activities, can affect your blood pressure, but it's not enough to cause hypertension. I don't know that you get my point. If you run from, like I said, you run from here to the nearest bus stop and I check your blood pressure, at that point, it might record something a little bit high. But when you sit down and you relax for 10-30 minutes and I check it again, I'll be able to get your actual blood pressure. So that does not mean that because I run from here to the next point and my blood pressure is high, I have hypertension. No, it is because I've just finished running.
So it's a myth.
My BP went a little bit up. If I rest, my BP is normal. But for someone that has hypertension, if the person rests from now till tomorrow, if you check it, it's going to be high. You understand? So it is the condition, the situation that makes that person's BP to go a little bit up. But when the person rests, it's going to get better. But For someone that has hypertension, it is not so. If your BP is high, if you have hypertension, you check your blood sugar today, tomorrow, next tomorrow, it's going to be high, except you are taking your medication regularly. So stress can tilt your BP a little bit up, but it doesn't cause hypertension.
Like when that anxiety that I asked about, like
Yeah, of course.
People that has anxiety.
Yes, anxiety. When you are anxious, you are bothered, and it also increase your stress hormone. So it also it goes in the same line with being disturbed, being stressed and all. But it is not a cause of hypertension, but it can affect. So someone that has hypertension, for instance, now that has been documented that this person has hypertension. If you are bothered, if you are stressed, if you have anxiety, it can tilt your blood pressure a bit high.
So people that say tó bá ti ronú o ẹ jẹ́ kí n ronú Nàìjíríà yìí ó tóró so mi ò lè lápàtẹ́ńṣọ̀ ẹ ṣe ẹ jẹ́ kí n ronú.
So what I would love to ask you now is about HIV. I don't know. I think there's a way that Yoruba translates anything, any word in English to Yoruba. I don't know, because táwọn Yorùbá sọ pé HIV wọ́n máa ní pé àrùn kògbóògùn. Okay, so I don't know how true that is, but first of all, I want you to explain or give us the definition of HIV. What is HIV? And
Please, before we continue,
is it?
please let's continue. Hypertension, I think, as is the medications, how people manage it. Ká tó lọ sí another topic. A kò sọ̀rọ̀ nípa ẹni, àti sọ̀rọ̀ nípa like what is the
Solutions and
Kí
everything.
ni nǹkan táwọn èlò
Solution is just to take your medication. We have talked about not take too much of salt, eating vegetable, exercising,
you
and all.
mentioned
Mentioned
it.
So the other thing is just to take drugs.
So let's continue.
Okay.
Sorry.
So HIV. So Yoruba call it àrùn kògbóògùn. Is it really àrùn kògbóògùn? Number one. Number two, what is HIV itself? What is the meaning of HIV?
All right, thank you for that question.
Welcome, sir.
So HIV, I think, is an acronym for a particular virus that is called human immunodeficiency virus. Okay, gẹ́gẹ́ bẹ́ẹ̀ sì sọ, àwọn Yorùbá máa ń pè ní àìsàn kògbóògùn. This morning, I will be dancing between kògbóògùn and ògbóògùn.
Okay.
You see, when HIV first came into limelight, that is when it first happened, when it was first discovered, there was no particular drug that could either help to cure or to even help to reduce the virus in the human's body. Wow. So at that time, a lot of people were dying from it, and that was when the idea of àìsàn kògbóògùn came
generated.
out.
Oh wow!
But with scientific development, with researches and all what's of that we can mention, we've been able to come up with medications
that can cure it.
Drug, no.
Okay.
It cannot cure it, but it can help to reduce the multiplication of the virus in an individual. And once the virus is being kept check, the virus is not multiplying, you'll be able to live your normal life. You'll be able to get married, you'll be able to do normal activities and live your normal life.
While you still have it, you can still.
While you still have the virus.
Really?
Okay. So let me talk basically, about the virus itself.
Okay.
So we call it, like I said the other time, human immunodeficiency virus.
Yes.
From the word immunodeficiencies is the immune. I don't know if you know what we call the immune. What helps to protect our body. More like what we can call the body soldiers. And so these are the things that help us to fight against malaria, parasite, help us to fight against any disease that you can talk about. So they are like, you have a soldier that surrounds your house.
That's guiding it.
That guides your
like
house.
an armor.
Okay. Now, this virus, what it does basically is to weaken the soldiers around your house, if not kill the soldier totally. So it comes into your body, it goes into your body and kill the soldiers that your body or the God has pushed in your body to help fight all the kind of infection you can think of. And imagine if you have a soldier around the house and the soldiers are weakened or they are totally dead. What will happen?
You get attacked too.
So you can get attacked with different diseases. So now imagine if we have a drug that rather help to weaken those things that want to kill your soldiers. So the virus are there, they are weakening and they are not multiplying.
Okay.
Sure, you understand. So your body, your soldiers are able to perform their functions, even though the virus are there. The soldiers are able to perform their function. They're able to protect your house, in this case, protect your body from diseases, and so you live your normal life. So it is àrùn kògbóògùn because there's no particular drug that can cure HIV. There's no particular drug, and that is why the prevention is better than cure. So there's no particular drug that can cure HIV, but there are drugs that you can take to help reduce what we call viral load, such that when they take your blood, it will not be detectable. They will not be able to see, because the virus needs to get to a particular level in your body before we'll be able to see it in your blood. And that is why if somebody gets exposed to HIV today, there's something we call window period. The first 3 months,
you will not know
that the individual is exposed to HIV. If you check the blood, you will not see it there, because the level of that virus has not gotten to that level that you can get in the blood. Okay, if you have a teaspoon of garri, put inside a bowl of water, and you dip spoon inside and take a little, you might not see garri, you might not feel that garri, but if you keep pouring that garri to a level and stay together, use your spoon to bring it out, you will see garri. So when an individual gets exposed to this virus, it continues to multiply from 1 to 2 to 3 to 100 to 1,000 to 1 million to 2 million to 3 million. Just give an example now.
Yeah, sure.
So if you continue to multiply, now get to a particular level that when you check the blood, you see it inside. At that point, it will be weakening the body soldiers. Once it's weakening the body soldier, the person will be having malaria, will be having chest infection, will be having tuberculosis, will be having different kinds of rashes on their body, they will be having vaginal discharge, and ultimately the life might go from it. So, but what drug is able to do is to reduce the multiplication from 1 to 2 to 3 to 4 to 4. It helps to keep the virus in check, such that the body is able to perform its function, the immune system is okay, and the person can live a normal life.
And please, I would love you to rephrase that part to the audience, and I want you to say it in Yoruba for the people that doesn't really understand English, that HIV kò ní cure, but we have medication that can suppress it in getting to aid or to generate, please.
Thank you for the word aid that you mentioned. So, ẹ̀yin ará ilé, àrùn HIV tá à ń sọ̀rọ̀ nípa kò ní oògùn kan pàtó tá a lè fi sọ pé tá a bá lò kòkòrò yìí á lọ pátápátá, but oògùn wà tí ó pé tá a bá lò á ràn wá lọ́wọ́ láti má jẹ́ kí kòkòrò yìí láti máa dàgbà sí tàbí láti máa pọ̀ sí. So tí kòkòrò yìí ò bá dẹ̀ pọ̀ sí, ó máa help wa láti live normal life. Now,
hate.
Don't
worry, presenter.
dárúkọ kankan lẹ́ẹ̀kan wọ́n ní AIDS. So we call, what's the meaning of AIDS? Is acquire immune deficiency syndrome.
Yes.
So that is the person's immune has been totally collapsed.
Hey.
So there are now different kind of disease. Are you getting my point?
Àsìkò yìí kò sóhun tó
Now
lè
the
ṣe mọ́.
soldiers, gbogbo àwọn tó ń surround ilé, àwọn ọlọ́dẹ àti sójà ní àtọlọ́pàá ní àtàmọ̀tẹ́kùn ní gbogbo wọn pátápátá ti kú.
Oh my God.
So bí o lè ṣe ń wọlé lápò ọ̀tún ló ń wọlé lápò òsì, wọ́n ṣe ń gbà létí lápò ọ̀tún wọ́n ń gbà létí lápò òsì, wọ́n ṣe ń sọ nídìí ní apá ọ̀tún wọ́n ń sọ nídìí lápò òsì. So that's so different. So the person will have a máa lose weight, a máa bì, a máa yàgbẹ́ olómi, a máa wúkọ́,
oríṣiríṣi ló máa
a
ṣe.
ní àìtàn tá à ń pè láìsàn TB. So different kind of disease lẹ́nu yẹn. So for us to prevent pé kó má débẹ̀ yẹn, ìdí nìyẹn pé a máa encourage àwọn yẹn ẹ lọ sí hospital. It is not bad every year, once in a year, check yourself. Don't say mi ò kóbìnrin, mi ò lo abẹ́rẹ́ tí o ṣe tèmi. Of course a sì máa sọ̀rọ̀ nípa àwọn nǹkan tá a lè ṣe láti prevent ẹ̀. But it is not still bad, ẹ lọ sí hospital bó ṣe ẹ̀kan ní ọdún. Èló ni test yìí gan in most private to government hospitals
free.
They are free.
Yes, it's true.
But many people will say tó bá lọ positive nǹkan mi ò lọ, tó bá lọ positive nǹkan mi ò lọ. So but it's not, go to the hospital, ẹ jẹ́ kí wọ́n jẹ́ ẹ̀yin wò. Tó bá dẹ̀ positive, I don't pray anybody gets positive, but if it is positive, there are things you can do to help it from developing from HIV to AIDS.
Exactly.
So please, ẹ̀yin ará ilé, ẹ jọ̀ọ́, ẹ jẹ́ ká rí gẹ́gẹ́ bí nǹkan tá a máa ṣe ọlọ́dọọdún, ká máa check the status wa when it comes to HIV and some other diseases that we can also check.
Ẹ ṣé gan ni sir, but mo fẹ́ béèrè nǹkan, àwọn oògùn tí èèyàn máa lò láti fi reduce much nípa HIV yẹn
Okay.
is it ṣó wà affordable ìyẹn kìíní ẹ̀kejì ètò wo ni ìjọba ti gbé kalẹ̀ ẹ mọ̀ pé nígbà tí àìsàn lassa
fever
tó jáde ńgbà yẹn wọ́n
There is something about it, yeah.
wọ́n sensitize wa wọ́n fún ní ká lọ ṣe gbá ní ká lọ ṣàwúrò ètò ni àwọn ìjọba ti ń gbélé tó dẹ̀ ti tó ń wà consistent till date
Lórí oògùn yẹn.
lórí oògùn yẹn àti ìtọ́jú fún àwọn tó bá ní.
Okay. Ẹ ṣé fún ìbéèrè tẹ́ ẹ béèrè yẹn.
Yeah.
Well, I must say at this point that I'm not a government representative, but the little I know, having worked in government hospital for some time now, I will say that there are a couple of interventions. There are a couple of interventions that governments, both the Nigerian government and the international organizations, they have put in place to help people that have HIV to live normal life. I even believe they have association. People that have HIV, they have association, and sometimes it is very possible for us to have seen them in our locality when they are doing their World AIDS Days.
Okay.
They come around, they dance around, they tell people to know their status and all. So the first thing is that there is free drug for every individual that has HIV.
Okay.
And it's available in virtually all the government
Hospitals.
Till
around
date.
till date.
Wow, that's a good news. I mean,
Both the government, the federal government and the international organization, this drug was gbogbo alamọ nǹkan tó ń ṣẹlẹ̀ ní orílẹ̀-èdè àgbáyé àti Nàìjíríà àti jẹun àti mú kò ń ṣe nǹkan tó easy láti wá máa há di owó. And these drugs are relatively expensive. So the government have made it free for every individual. All you need to do, go to the hospital, get tested, and then they will start you on medication.
Immediately.
And as you are taking the medication, you will also be going for checkup. They will be checking what we call viral load. That is the load of this virus, of this kokoro in your blood. So they will be monitoring it and they will be giving you your medication. You can marry, you can live normal life with it. So, like I said, there is a facility for medication which is free, and there is, organizations for people that have HIV to come together to discuss, because a lot of things that happens to them, stigmatization. Some people, when they hear that their friend has HIV, they don't want to be their friends again. They want to. I don't want you to even come near me. It's not like that. People that have HIV, you can't get this HIV by we talking, by we seeking each other, by kissing. No, you can't get this HIV from
By
that.
kissing?
Oh, you can't get this HIV from
Really?
that. Of course, except if there is a mark or a cut or a wound, and there is an exchange of body fluid, whether blood or something, through that open wound. So, but you have HIV, you can get married, you can live your normal life, and there are provisions in the government hospital for free medications.
But normal life yìí ó really wà concern sí mi because only it's a transmitted disease.
Yes.
Am I right?
Yeah.
So ẹni tó bá ní tó ẹ̀pọ̀ ọkùnrin lónìí tó fẹ́ ìyàwó tí ò ní tó máa jọ ní
ìbálòpọ̀ yẹn.
ṣé kò ní affect ẹ̀ àbí oògùn tó bá ti ń lò ẹ̀ ló máa reduce ẹ̀ ní àbí báwo ló ṣe máa yọ pé a máa live normal life.
Okay. So tí ọkùnrin bá wà tó ní HIV tó bá ti ń lo oògùn yìí ó ní nǹkan tá a máa ń check mo pè ní viral load lẹ́ẹ̀kan,
Yes.
which is the amount of this kòkòrò nínú ẹ̀jẹ̀. Once the viral load is not detectable, ṣe kí mo sọ kíní kan lẹ́ẹ̀kan pé tí kòkòrò yìí bá kọ́kọ́ dára individual lẹ́nìí for the first 3 months when you check the blood ẹ lè rí nǹkan kan bẹ́ẹ̀. Ìdí ni pé level virus yìí kò tí ì pọ̀ tó nǹkan tá a fi lè rí. Ṣé nǹkan tí mo sọ yé yín? So tí àwọn tó ní HIV tán bá ti ń lo oògùn wọn to the point pé tá a bá check ẹ̀jẹ̀ wọn a lè rí. Ó wà ń bẹ̀ o but a lè rí. When we are checking the viral load we cannot see it. Irú wa ni ọkùnrin yẹn tó bá ń bá ìyàwó ẹ̀ lájọṣepọ̀ ìyàwó ẹ̀ ò lè ní látara ẹ̀. Á bímọ ọmọ ẹ̀ ò lè ní. Ṣé nǹkan tí mo sọ yé yín? So and that is the same thing that happen in that window period. The virus is there for the first 3 months. You cannot see it in the blood, but it is there. It has not gotten to the level that can be transmitted.
Okay.
So we can use the drug to keep it below a transmittable level.
So ká wá béèrè nípa kí ni nǹkan tó kọ̀ sí ká like bí bó ṣe lè gbà bá ṣe lè fúnra wa
Okay.
ká tún bá ṣe lè spread ẹ̀ àti bá ṣe lè prevent ẹ̀ ká kulẹ̀ sọ papọ̀.
All right. The first thing I will say is that if an individual has HIV, it is very important for that person to live positively. Okay, so and that's what people call positive living positively. An individual is positive with HIV, but is living positively. You know, some people believe that wọ́n kó kinní ràn mí èmi náà kúnra wọn.
Bẹ́ẹ̀ni àwọn èèyàn
àti gbọ́ dáadáa.
Bọ̀bọ̀ tí mo gbé ní last week yẹn ló kó kinní ràn mí èmi náà máa kó kinní ràn yàn rárá o.
That's correct.
If you test positive for HIV, the first thing that you must live positively, and living positively means that you must ensure that you do everything possible that you don't give it to others. So how do people get HIV? From blood that has HIV coming in contact with another person blood that doesn't have HIV. I'll give an example. Somebody is sick in the hospital and he needs blood. And they just say, ẹjọ́ wá fún wa lẹ́jẹ̀, ẹjọ́ wá fún wa lẹ́jẹ̀, èmi lẹ́jẹ̀ o, máa fẹ́ ni ẹlẹ́jẹ̀. Wọ́n kàn bùn ẹ̀jẹ̀ nìyẹn, wọ́n mú ẹ̀jẹ̀ lára ẹnìyẹn, wọ́n dẹ̀ dàpọ̀ mẹ́jẹ̀ nìyí, kó tó rí pé ẹnìyẹn nídìí ẹ̀jẹ̀. Wọ́n screen ẹ̀jẹ̀ yẹn láti mọ̀ bóyá ẹnìyẹn ní HIV.
I know, that's unprofessional.
Of course, we don't do that in the hospital settings. But if it dare happen at any given circumstances, that individual can get HIV. Gẹ́gẹ́ mo sọ lẹ́ẹ̀kan, ọkùnrin àbóbìnrin tó ní HIV tí ò lògùn rẹ̀ déédéé tí viral load ẹ̀ bá high tó bá lájọṣepọ̀ pẹ̀lú obìnrin akọ̀ràn. Ẹni tó lè HIV tó mú blade tàbí whatever needle tó fi cut tí ẹ̀jẹ̀ yẹn wà lójú ẹ̀ tí ẹni tí ò lè HIV tó lo blade tó lo needle yẹn
tó gé òun lọ́wọ́
ó lè ní HIV láti bẹ̀.
Sorry, ṣé tí ẹ̀jẹ̀ bá gbẹ náà ó lè ní?
The virus can stay even for many days, if not months.
Days.
Even after the blood has dried.
On the object.
It is still going to be active.
Really?
And that's why you need to disinfect, some of these instruments, whatever we use. Okay? And blade. How much is blade? Get your blade. Needle. Don't reuse needle. Use a new needle where you want to use any needle.
Even for yourself.
Even for yourself. Okay. There are many ways that people can get it. A mother that is having HIV that is not taking medication regularly and the virus is so high in the blood, the baby can get it by breastfeeding.
Sure. Breastfeeding.
Yeah. But however, if the mother takes medication well, that the viral load is very low, the baby can breastfeed and there won't be, and the baby will not get it. The mother will have HIV, take her medication regularly, and she will give birth to a baby that doesn't have HIV.
Okay, sir. Do you have? Okay. As a doctor, have you ever imagined or think of having this facility that can cure it? What's it called?
Totally.
Finally, totally in next coming years. Maybe through a conversation with other doctors or your research. Have you ever thought of that?
Okay, so in medicine is a very broad,
of course,
field, and we have people in different fields. Of course, like I said, that the notion or the belief of àìsàn kògbóògùn came initially when this virus was detected. There was no medication at all. Kò sí ẹ̀sìn oògùn kankan tá a ṣe lè lò pé láti ẹ̀ ti fi reduce bó ṣe ń dàgbà. But people went into the lab, they went into the research, world, and they keep researching on this virus. Wọ́n ṣe oríṣiríṣi iṣẹ́ lórí virus, and that's how they are able to come up with medication pẹ̀lú àwọn oògùn tá à ń sọ lénìí táwọn èèyàn lè lò láti reduce the virus. They say never say never in medicine. Never say it is not possible. Of course, HIV has been now for many years, and researchers has been doing everything possible to be able to come up with medication that can cure it. But as of now, there are no medication. Whether there will be medication tomorrow that will cure it, I may not be able to tell. But one thing that is very important for our people to know is that HIV is real, and they do everything possible not to have it. If they have it, it's to ensure that they take their medications.
Okay.
So mo fẹ́ gbé yín kúrò díẹ̀ lọ sí ìta.
Mo fẹ́ gbé mi travailler.
Mo fẹ́ gbé ìta tí mo fẹ́ gbé yín lọ ni pé.
Not carry doctor where you know.
Mo fẹ́ gbé yín lọ sí amara testimony ni pé I have mo lọ ṣe test mo ní cancer and mo gbàdúrà mo ṣe gbà mo ṣàwo cancer ti kúrò. Scientifically in your medical is it real? Does it look positive? Pé o ti test ara ẹ o, pé o ti confirm pé yes o ní, kò pé or any other disease that might actually look now after ìgbàgbọ́ wa ká tún lè HIV náà but ìgbàgbọ́ wa ní Nàìjíríà pé kò sí nǹkan lóhùn lè ṣe o wá after few days o wá notice pé o tún wá lọ ṣe test o wá negative ẹjọ.
No, actually, he's talking as if he's a living testimony. Are you a living testimony?
I'm not a living
One stress
testimony.
So, like I said the other time, I'm a doctor. At the same time, I'm a child of God also. And I equally believe in divine miracle. Doctor, medicine, all those things. There were things that our parents were using before medicine came into limelight. And I still believe God still does wonders. God still does wonders. And until you see one, you will not know. And like my sister said, you might be talking from experience. So and who am I to tell you that your experience was false? I cannot force your experience. Because experience are things sometimes when you tell people, they might not be able to believe because it doesn't align with their thinking or their knowledge. But that doesn't mean it is not real. So scientifically, they believe that HIV is a virus. Cancer is there. And there are ways we can manage it. But God also have his own way of dealing with his people.
Exactly.
So medically, we have our way. And God also have his way. And I want to tell you that I believe there are divine intervention in people's life. But however, if somebody has HIV, which is what we are talking about, if you have HIV, you need to be sure it has been cured before you start taking your drugs.
Very sure. So please be very sure.
Church and they prayed for you, or you even pray personally yourself, and God heals you. Glory to God. Hallelujah.
Hallelujah.
We are happy. But go to the hospital, check it all. Ensure that pé ó ti lọ. Tó bá tún check ẹ̀ ń bí lọ sọ́nà the hospital. Tún lọ check ẹ̀ o. Check it. Ó mọ̀ pé ó ti lọ tóòtọ́. Kó mọ̀ jẹ́ pé òun tanra rẹ̀ ni. Ìgbà tó bá fi jí ní in another 10-15 years, ó ti máa develop sí what we call AIDS, which is what we don't want. So God can cure anything. God can do anything. And I believe in that as a doctor.
That's
However,
fine.
if you're sure something you have been diagnosed with one condition and you are prayed and God has done, please ensure that it is
you do your checkup.
Done. You do a checkup to be able to confirm that it has been done, so that tomorrow you will not regret it. But God, when God does something, it's usually permanent.
Thank you so much
Thank you so
for
much
that.
for that.
Kò tó fẹ́ gbọ́ lẹ́nu ò lè gbọ́.
Don't
mind
them.
Actually,
So, kò tó fẹ́ bẹ̀rẹ̀ sá. Níbi 2 months ago, síbi last month, a gbọ́ pé wọ́n ní Trump, US president, wọ́n fẹ́ stop the age tó fi ń sọ pé wọn kọ́ àwọn náà sọ most of the bills HIV drug yìí. Kí ni àwọn nǹkan tí bí affect doctors ní pé ó máa affect ẹ̀ pé patient máa yapa gan. Àdúgbò èdè máa ń wọ́n gan. Gbèsò àti pé ṣé with the follow up bó ṣe lóòótọ́ ló máa padà stop wage yẹn pé wọ́n ní fún wa ní Africa mọ́ a bá fowó rà ní.
Well, thank you for that question. Okay, so I also read the same way you read it, that the new president of the United States of America, President Trump, did some kind of investigation into a lot of interventions that United States has been involved over years, and they find out that a lot of fraud, have gone into it. So, in a bid for him to sanitize that particular, part of the government of the United States, the initial step he took is to stop some of those interventions into many countries, including African countries, Europe, and other countries in the world. Okay, and that is why, irrespective of what the foreign government, the help we are getting from foreign government, our own government, I'm talking about the government of the federal government of the Buhari and even the state, they will also wake up. We cannot continue to be getting this thing free every time. And I think I watched of recent that the federal government are launching some program, to cushion the effect of the announcement that Trump made. And I also heard, though not verified, that the government of the United States are also trying to to rethink their decision about withdrawing that support. So, but one thing I'm sure is that people can still get this drug for free as at now.
Now.
Yeah.
So Emma Foya, actually get, and I'm so happy that our questions were enforceable for and for our audience. I want to thank you so much for that. Thank you for enlightening us on that. So now let's divert to the next one, which is Lassa fever. This is another big something like it has been outside for like few years ago. Like I think I've been up like 6-7 years ago. So can you tell us what is Lassa fever itself? Can you explain Lassa fever?
So Lassa fever, from the word Lassa, so it's a virus.
Okay.
That is Lassa fever is a disease. Will I call it a disease or illness that is caused by a virus called Lassa virus? The same way we call HIV, it is caused by HIV virus. So this is also caused by Lassa virus. And it will surprise you that this virus was first discovered in Nigeria. First discovered in Nigeria.
At first, like FIRS.
The first time it was discovered in 1969. It was discovered in a town called Lassa in Borno State. And that is why they call it Lassa virus. So it was not discovered in a town called Lassa in Borno State in the northern part of Nigeria. So in 1969, and it was named after that town, Lassa. So it's called Lassa virus. So like I said, it's also a virus, viral infection, viral disease that is usually being carried or that lived inside the rats. And you know, there's a name we call it Mastoming latalensis, but we don't need that name. Àwọn eku yìí virus yìí máa ń wà ní inú ẹ̀jẹ̀ wọn, nínú itọ́ wọn, nínú ìtọ̀ wọn, nínú ìgbẹ́ wọn. Virus yìí wà ńbẹ̀. Kò ní ṣe nǹkan kan fún wọn o. Tẹ́ ikú yẹn bá 100 years lọ ẹ kó lò láyé á 100 years ẹ pé a bímọ, a ní girlfriend, a ní gbámú, a ní kọ̀ǹpútà, kò sí nǹkan kan tó máa ṣe kú yẹn. But tí virus yìí tó bá dàpọ̀ mọ́ oúnjẹ wa, tó dàpọ̀ mọ́ gàrí wa, tàbí tí a mú eku nínú ilé bóyá pé kò sí oúnjẹ afẹ́ jẹku, all those kind of things.
Yes, sir.
Some people eat. I don't know. I've not seen somebody.
No, actually, eku kini ni eku igbo.
Àwọn eku ẹ̀wọ̀n jẹkulé.
Eku.
Some people are eating ekulé.
Okay, you were saying.
So if the virus gets, the virus gets into our food, the blood, the urine, the saliva of the virus, of the rats gets contaminate our food. We can get this virus, and this virus is relatively fatal. In Nigeria, this year 2025, about close to 100 people has died from Lassa virus.
Is there no cure for it?
It's a virus, so there is no cure for it.
There's no cure.
It can be managed.
Just like HIV.
Not exactly like HIV. People that have Lassa virus, when they are treated, they will be fine, and then they will be okay, and they will not have it for life.
But say it can't be cured. That means it can be cured then.
Well, should I say it can be cured? It can be managed, and the person will be free of it. But it is relatively fatal. By this, if somebody comes down with it and the person does not prevent to the hospital very early, the person can die within weeks.
Within weeks.
Unlike HIV that will be in the body for 3 months, you don't even know you have it. If you don't go to hospital in another 1 year, 2 years, 3 years, you might not know. This one, it works faster and it kills people faster. But if you are having symptoms, you go to the hospital, you get tested, you get treated, you will be fine, and you might not have it again if you don't get exposed again. Okay, and that is why we need to talk about what we can do to prevent it, because symptoms àwọn nǹkan tí ó máa ń ṣẹlẹ̀ sáwọn tó ní Lassa fever yìí or Lassa virus yìí ó jẹ́ nǹkan tó yẹ pé normally you might just be thinking you are having malaria. Ara gbígbóná, ara ríro, weakness. Then before you know it, you might be vomiting, you might be having tummy pain, you might be passing loose too. But the hallmark of it is bleeding.
Bleeding from where?
Bleeding from the nose, from the mouth, from the vagina, from the anus. Because we call it hemorrhagic fever or viral hemorrhagic virus. So it's a kind of virus that can cause bleeding, but later on in life, later on after like 2 weeks that the individual has been harboring the virus. Share your
kò
dad.
sí pẹ́.
So the best thing that we encourage people to do when we are talking about Lassa virus is to help do whatever you can do to prevent you coming in contact with it.
So bá ṣe lè gẹ̀tẹ̀ ṣé a lè gẹ̀tẹ̀ through skin to skin. Torí gbogbo pé àwọn doctors kan àtàwọn nurses kan tún kú while treating the patient.
Skin to skin, how? Like,
Yeah,
okay, to
touch,
touch, okay.
I will explain. So through body fluid generally,
Okay.
that's saliva, vaginal fluid, blood from an infected person to an uninfected person. Okay, let's just talk about how it can get from rats to an individual.
Okay, yeah.
Then from individual to
to
individual.
others.
So from rat now, if you have food stuff in your house, oúnjẹ wọn eléyìí tá tún ní ẹ jẹ́ ká keep ẹ̀ dáadáa.
Bẹ́ẹ̀ni.
Because tá bá sọ fẹ́ lómi pé oúnjẹ tẹ́kù ti yàgbẹ́ sí tó ti ṣe kí ẹ lọ
máa
dànù
ṣàwúrẹ̀ kúrò.
wọn láwọn máa sọ àárẹ̀ kúrò wọn á manage ẹ̀ bẹ́ẹ̀ Lassa ló fi ń ṣeré o. So but what can you do? Ensure that you keep your food in a container that the virus the rats cannot have access to. So ensure that your food are well kept, and then if possible to eradicate rats in our house, but I doubt it if it is possible for you to eradicate rat. By this I mean you won't have rats in your house at all. That is going to be very difficult. But whatever you can do to reduce the amount of rats in your house, please let us do it. Àwọn ògbékú wà táwọn èèyàn máa ń fi sílé. Then keep your house clean. A clean house, even teku bá máa wà ń bẹ̀ bóyá àwọn eku bíi méjì mẹ́ta ni. Bọ́ ilé ẹlòmíì á gbé àjẹkù rice síbí, àjẹkù ẹ̀wà síbí, àjẹkù kíní kan síbí. Gbogbo àwọn kan báyẹn ni àwọn rats yìí ó máa attract rats. Ṣé you understand? So try to reduce the amount of rats, if not get rid of rats totally in your house. All your food stuff, especially gbogbo àwọn gàrí tó bí a kàn máa ń bù sómi a kàn máa ń mú ni tí o ṣe nǹkan tó máa go through fire that way. So please keep it away from the rats. You understand? And if it now happen by mistake that rat tọ̀ sí gàrí wa ọ̀bọ̀ tọ̀ sí kíni ẹjọ́ wọ́n máa pèsè owó fún wa ẹ jẹ́ ká rárá wá bá ṣe dà yẹn nù kí ká wá bá ṣe dà yẹn nù ká dẹ̀.
ṣé tèrè ṣe rí àwọn èkú yẹn sìn honestly ọpọlọ tó wà lórí wọn ó ju tèèyàn lọ ìyẹn ó máa ra gọpa ó dẹ̀ máa forí gọpa lójú ẹ̀ ó dẹ̀ máa jump.
Kí ni gọpa ẹ̀ wà fún?
láti mú wọn ni.
Eku náà fẹ́ kú.
ayé sà ọpọlọ wọn yẹn mi understand tó ṣe ọpọlọ
yẹn.
mamas ni
wọ́n ń jẹ wá ní pé káwọn náà máa lọ pọ̀
eku ò fẹ́ kú ara lélẹ̀ onígbà fún un.
Bẹ́ẹ̀ni.
àwọn òde mọ àwọn òde fi ṣèkà oúnjẹ nǹkan tó ń jẹ náà wá wọn òde fẹ́ pàdé tí ó ń jẹ wọn. ìkọ́ tá a bá ń jáde láàárọ̀ àdúrà
máa ń gbàdúrà káwọn jáde ká má pàdé tí
ó ń jẹ wọn.
Doctor, come to think of it ṣé epo ṣó ní brain tí ó wà active
Only
báyìí?
Only brain. There are people we call veterinary specialists, doctors, veterinary medicine specialists. They deal with things like that. You understand? Not veterinary medicine. They deal with animals.
All kinds of animals.
Dogs, cow, different things. So they have their own brain too. And that is why when you open your door, if you are already in your parlor, boom, they move. They know you are coming.
Really?
And no matter how sweet the food is, to bá tẹ oúnjẹ sí wọn á máa wò pé sóòsì wà ń bẹ̀ káwọn tó wá síbẹ̀.
And it's true.
Sure, you understand? So that is why keep your food, ensure that your house is clean. Ilé tó bá mọ́ tó bá dọ̀tí ò dọ̀tí wọn bá ní eku tó máa wà ń bẹ̀. Then àwọn oúnjẹ wa jẹ́ ká cover ẹ̀ dáadáa.
Bẹ́ẹ̀ ló rin àgbè sínú orin torí oúnjẹ kégan sí.
wọ́n jẹ bàtà wọ́n jẹ bag.
kò sí nǹkan tí wọ́n lè jẹ́ sí.
Ebi ni.
wọ́n á jẹ ike yẹn tó jẹ́ pé bẹ́ẹ̀ ká máa gbé sínú orin.
wọ́n lè jẹ nínú.
Whatever we can do to protect our food from the reach of rats, we have to do it. And if you have, even if it is common malaria, please let's go to hospital. The minimum that will happen is that kí wọ́n ṣe test malaria fún wọn tó bá dẹ̀ pé malaria ni wọ́n á treat ẹ̀ tó bá dẹ̀ treat malaria tó ní pé fífà yóò lọ àwọn onímọ̀ òṣègùn òyìnbó wọ́n mọ̀ pé ẹ jẹ́ ká wò ó ṣé kìí pẹ́ nìyí ìfẹ́ ní Lassa wọ́n á dẹ̀ mọ̀ bí wọ́n á ṣe
detect.
tẹ̀lẹ́kẹ̀tẹ̀ fi style sọ̀rọ̀ nípa self medication yẹn bẹ́ẹ̀ ṣe ń sọ pé tó máa feel anything go to the hospital ẹlòmíì paracetamol ló máa lò sí oògùn.
I'm the kind of person that I like to be realistic. How many people in today's Nigeria can afford health care?
It's true, Sha.
You see, as much as I encourage àwọn èèyàn pé kán máa lọ sí hospital, it is not easy out there. For you to access healthcare in Nigeria, you need to have your money. And so some people believe that malaria ló ń ṣe mí jàre, jẹ́ kí n sáré lo paracetamol. Inú run mí, bóyá oúnjẹ tí mo jẹ ní jẹ́ kí n lo Flagyl. Well, those are what we call self-medication. Because orí fífọ́ ń gbà míì, ó lè jẹ́ pé nǹkan míì ló ń fa o. Ẹlòmíì ó lè jẹ́ pé cancer ló ní lórí tó ń fa orí fífọ́ fún. Ẹlòmíì ó lè jẹ́ pé kíní kan ló wà lórí ẹ̀ tó ń fa orí fífọ́ fún. Ẹlòmíì ó dẹ̀ lè jẹ́ malaria ló fa orí fífọ́. Ìfúnpá gíga ó máa ń fa orí fífọ́. So the best thing you can do is just, even if it is common health center you want to go to, let them check your blood pressure. Let them check your blood for malaria test. There's something we call rapid diagnostic test for malaria test. Wọ́n á kàn prick ẹ̀ báyìí. Wọ́n á dẹ̀ fi sórí kìíní yẹn. Bí àwọn bí pregnancy test. So wọ́n á dẹ̀ mọ̀. So tí wọ́n bá dẹ̀ ti gbé àwọn treat malaria fún ẹ kò lọ, wọ́n á lè mọ bí wọ́n á ṣe pé àwọn tó ń ṣe test pé pẹ̀lú Lassa virus tó common yìí, ẹni yìí ara ẹ̀ ń gbóná, wọ́n ti treat malaria kò lọ, ó ń bì, ó ń ṣe kìíní, jẹ́ ká test. Tí wọ́n bá dẹ̀ test, wọ́n á treat ẹni á dẹ̀ wà okay.
So, cut round of, just take one question from my colleagues. One question. Let's go.
Question, yes, sir.
Okay.
So from what to transfer from person
Okay,
to
from
person to person. Also, if an individual tó ní Lassa virus, so àti sọ nípa rat sí human being. So from human being, from the blood of human being, tí ẹ̀jẹ̀ bá dàpọ̀ bẹ́jẹ̀, tí ìtọ̀ ẹni how will I put it now? Ìtọ̀ ẹni yẹn tó dàpọ̀ mọ́ tó bóyá ẹnìyẹn ní wound, bóyá in kiss, and then there is a wound on the lips, then you bleed and you are kissing and the fluid gets into the open place, you can have it. If it is when any through sex, where fluid, vaginal fluid, and there's a wound on that particular penis, she understand. So through body fluid generally, through urine, through feces of that person to contaminate and to ní Lassa virus, ó lọ lẹ́gbẹ̀ẹ́, ó yàgbẹ́ tán, ó fọ̀dí, ó fọwọ́ yẹn, ó fi sáàfù oúnjẹ, ẹni yẹn jẹ lọ.
So tí o bá lo spoon báyìí, ó fi lo spoon fi jẹun sí, ìtọ́ wà lórí ẹ̀, tẹ́lẹ̀ bá fi spoon yẹn jẹun kọ́.
Rárá, àfi tó àyè pé ẹnìyẹn ní wound, tó àyè pé tọ́ so body fluid generally blood, vaginal fluid, urine, semen, stool, all those things that is contaminated with that virus.
But báwo ni ó ṣe wá pa àwọn doctors? tó fi jẹ́ pé doctors and nurses are dying?
Because well, I don't want to put blame on government. I want to believe every health practitioner knows what to do to protect themselves. We're exposed a lot. Every disease that happens in the world will land in the hospitals. And some of these diseases, in fact, we have not even talked about airborne disease. There are some diseases that you can get it. You understand? So we are exposed, and that is why we need to, as health workers, we need to have high index of suspicion. So if somebody is coming in with symptoms that suggest Lassa virus, you need to protect yourself. You need to wear your gloves. You need to ensure that if you have wound, you cover the wound, so that you will not get exposed to this fluid, body fluid, blood, because you need to set line. Blood will come out of it. Imagine you now have a wound in your hand. You are trying to secure an IV access for that person. You are not wearing glove. The blood splashes on your body. Then you have it. You understand? So we are exposed a lot, and that is why doctors sometimes can have it. A lot of doctors have gotten HIV from treating patients.
Yes, now.
A lot of doctors have gotten a lot of things from treating patients. But that's what we are called for. But however, we also need to be pragmatic. We need to be able to protect ourselves, even as God protects us.
So actually, okay, I just want to brief a little bit on the infection, just for us to go there. So the infection generally, that's number one. And then number two, can a lady contact, or let me say, can anyone contact infection through sharing toilet together? Or maybe public toilets, I be what and share toilet on infection. She only contacted.
I don't share that knowledge. I don't share that belief.
Okay.
That you can get infection by mere using a toilet that an infected person has used. I don't believe. Maybe that person is having the infection before that the development of that, the multiplication of that virus now happens around that time that person used use
The
the
toilet.
toilets.
Okay.
However, it is very important for us to ensure that the toilet we use are clean
Clean.
and they are devoid of germs and diseases.
Also, you put tobacco flush and put jams in my love before you. Is it true?
Tobacco.
Flush toilet, like if you want to use a public toilet, if you flush it first, you know.
Germs are not like that. Though.
Tom.
Germs are not like that. But it is better you use.
Flush it.
There are toilet wash that you can use. It is not the water that will take the virus away, or that will take the bacteria, whatever you call it away. It is those disinfectants, all those. I don't want to advertise anything.
No, they didn't pay.
So, but we all know them.
Yes, we
that
know.
we can use to wash our toilet to make it clean. You understand?
So how about the infection staying in the woman's body than the male body, like female body than the male body? Is it true?
That it takes longer in the female's
female
body
than the male.
than the male. But
For it to be detected, so before you know.
That is true. A woman might have a gonorrhea infection, for instance, now, and she might not have any symptoms. But if a man have a flesh-to-flesh sex with her, she might have it from her.
You know, I know, like. Go to Mosoni
Bó ṣe pẹ́ lára sí.
Báwo ló ṣe pẹ́ lára sí tí wọ́n fi mọ̀?
So okay, tí obìnrin á fi.
Wọ́n wá sọ wípé obìnrin máa ń mọ̀ ju ọkùnrin máa ń tètè mọ̀ ju obìnrin
ọkùnrin
máa ń pẹ́ lára obìnrin.
It is because generally as ọkùnrin we don't usually have discharge.
Oh.
So I don't know. I have a man here and I also have women here. We don't have discharge, but obìnrin máa ní discharge.
Yes.
And you need to be able to differentiate between normal discharge and abnormal discharge. A lot of women don't know the difference between normal discharge and abnormal discharge. So now one of the symptoms ọkùnrin máa ní ni pé ká máa tọ̀ kó máa jó wọ́n dì. Nǹkan bí funfun kó máa jáde lójú okó wọn. So imagine nǹkan funfun jáde lójú ara obìnrin. They will just think it's their normal discharge. They will not know they are having infection already.
Okay, but normal discharge is normal.
No,
That is it.
Our own is
So
different.
you naturally you have this discharge. So when you are having another
But it bring
discharge,
odor or something.
so when it's coming up with odor, the color is changing, you are having itchiness, you know that an infection has come in. But for men, immediately about in Thailand tó kó báyìí ó ti mọ̀ pé ó ti kó nǹkan nìyẹn àbí pé òun rí nǹkan funfun tó ń jáde. Another thing I want to say before we round up is that there's something we call douching, kí obìnrin máa fọ ojú ara wọn pẹ̀lú ọṣẹ àti kìíní. It's wrong. If there's anything.
Is it just pelvis or inside?
Àwọn èèyàn máa ń fọ inú ojú ara wọn pé àwọn fẹ́ kó mọ́. I don't know bóyá torí pé wọ́n fẹ́ lọ ṣe nǹkan tí.
God bless you, please tell us.
It's wrong because àwọn kòkòrò kan wà tí Ọlọ́run ti fi sí ojú ara wa. Kòkòrò Ọlọ́run à ń pè wọ́n ní normal flora. They are there naturally to keep that place healthy. They are normal kòkòrò. You see there is kòkòrò on my body. That are normal for my body that God has put there. We call them normal floras.
Okay.
Normal floras. They are helping to keep the natural condition of our skin, of every part of our body. See, when you now wash it out, you are helping the abnormal kokoro to grow.
Oh.
Because it is that normal kokoro that God has put there that is keeping in check the abnormal kokoro. So just like you send away your soldiers, you allow the police, send away the soldiers, allow these armed robbers to come in. So it is wrong for you to use ọṣẹ láti máa fi fọ ojú ara. Just clean with water, wipes, and that's all.
Only go for cervical cancer, is this true?
Cleaning?
No, see your band to your chef ojú ara.
No.
Is it true?
I'm not aware of that.
Okay.
I'm not aware of that. Things that cause cervical cancer.
Torí actually, lots of ladies believe that if washing the private part with soap, or for cervical cancer. Or pelvic cancer or something.
No.
Oh.
Cervical cancer is caused by a virus.
Virus, okay.
Yeah, that's a viral infection that causes viral cancer.
Okay.
Wọ́n nípa wọ infection kan wà tó jẹ́ pé even tẹ́ bá lo condom ẹ̀ sì lè ní wọn. Ṣé lóòótọ́?
Generally, condoms helps, apart from preventing pregnancies, it helps to prevent infection.
Yes.
So I'm not aware of that infection. So àbí tí condom yẹn bá bẹ́.
Àbí tí kò gòkè tán, àwọn short one yẹn.
Ẹ̀jọ̀ mo lè sọ ọkọ nínú àwọn tí gbogbo wọn ní syphilis. Ṣé mo pé ìyẹn máa ń ní pé kòkòrò ni? Ìyẹn ó máa ń dá egbò sí ojú ara. So tó bá ti dé skin to skin, kò sí kẹ́ lo condom náà. Skin to skin náà máa wà bẹ́ẹ̀. Ó ṣó possible.
My sister, what I will advise our people is that abstinence. B, be faithful. And C, please use condom.
Abstinence, be faithful, and use condom.
Ẹ jẹ́ kí mi sọ Yorùbá. Abstinence is má sùnmọ́ ọkùnrin, má sùnmọ́ obìnrin. Dúró nílé ẹ̀ dá dúró. Ẹlẹ́kejì use condom. Lo rọ́bà dáàbòbò.
Ó máa dáàbòbò ẹ́.
Jẹ́ kó dáàbòbò ẹ́. Kí ni
Faithfulness.
Ṣé olóòótọ́?
Ẹ̀yin ọkùnrin ẹ má cheat.
Ìyàwó ẹ àti ọkọ ẹ. Bí tẹ́ bá ti ń gbé dúdú gbé pupa náà.
Tọkùnrin bá ti ń gbé bẹ́ẹ̀ ni.
Obìnrin tó ń gbé dúdú tó ń gbé pupa náà.
Máa là
Ẹ rọra o.
èwo ní ọkùnrin nìkan.
Ẹ ṣọ́ra yín.
Oh, Dr. Femi Akanwo, really appreciate your presence here. Thank you so much. Because I feel fulfilled. I'm happy because I've learned a lot today about medical and everything, especially the viruses and all. Thank you so much for the enlightenment. I'm very sure that our audience, our ẹ̀yin ilé mọ̀ pé ti rí ẹ̀kọ́ bíi méjì mẹ́ta mẹ́rin márùn mẹ́fà méje mẹ́jọ 20 ẹ̀kọ́ ojú bẹ́ẹ̀ lọ́kọ́ lẹ́ni tí wọ́n fẹ́ para wọn nìkan lóko. So we want to know your view in the comment section, and please, when you're writing that your view, help us thank Dr. Femi Akanwo for coming to enlighten us on this, because it's very important. Because we still bring him again.
We have questions.
We'll keep bringing him. So thank you so much for joining us on today's episode. Like I said earlier, I am very sure that you enjoyed today's episode.
Very sure.
Except if you want to lie, I know. So I still remember your beautiful girl, Toyin Mercy and OG.
Please subscribe, like, comment. We want to see more of you, so you see more of us.
Tell me, what can you say?
Yes, so my own is I drop a question. If you have questions, if they want to ask our doctor here, drop your question in the comment section. And them are attending. I will go for only answer one question. And don't forget to subscribe. Yeah, very, very important. That subscribe button. Click it.
Yeah.
Offending
Bala. And also, if there's anything that you feel that you want to ask doctor and party sorrow you can just write it in the comment section. It will be available to answer. When it want to answer, so I know I throw it. So don't be shy. Don't worry. Feel free. Thank you so much. See you next time.
Bye.
Stay jiggy. Bye.